I'm Dr. Michael Cantrell. I'm a sports medicine orthopedic surgeon at TOC, the Orthopedic Center in Huntsville, Alabama. I see patients in our Huntsville office and our Madison office. The rotator cuff is a group of tendons that attach to the ball and socket of the shoulder. So in the shoulder, we have a ball and a socket. And the rotator cuff is a group of tendons that pass over, in front of, and behind the socket and attach to the ball on the top, front, and the back. So it's actually a sheet of tendons that attach to the back, top, and front of the ball. The purpose of the rotator cuff is to stabilize and move the ball and socket part of the shoulder. Rotator cuff tears happen in two ways. One is an acute injury, so a normal rotator cuff that has an injury like a fall or an injury at sports that actually pulls that tendon off of the ball and socket. More commonly, rotator cuff tears are degenerative in nature. Over the many years of use, as that rotator cuff tendon is pulling on the ball, sometimes that tendon gets worn and as part of that sheet of tissue pulls off. Those typically start as partial thickness tears. In other words, some of the thickness of that sheet of tissue is worn and pulls off, and the remainder of it is still intact. Sometimes rotator cuff tears that are degenerative become full thickness tears because those partial thickness tears don't heal and they will grow over time. The main symptom of rotator cuff tear is pain. Most commonly, it's an aching pain that's there all the time. Sometimes it comes and goes. Additionally, patients will commonly have sharper pain with use. The pain is felt typically in the shoulder itself and can extend down to the elbow or maybe a little further and up into the neck as well, and typically worsens with overhead use. Additionally, patients will feel weakness in their shoulder, partly because of pain inhibition. In other words, it hurts too much to use it strongly, so it feels weak. But sometimes that disconnection makes the whole structure weak so that the muscle strength is not there. Additionally, rotator cuff tears commonly hurt at night when patients lie down. So if you notice that the shoulder hurts a lot when you're trying to sleep at night, that sometimes is a sign of a torn rotator cuff. There are two broad categories of rotator cuff tears: partial thickness tears and full thickness tears. Partial thickness tears are where the thickness of the tendon is torn partially off the bone, such that you wouldn't be able to see right through the tendon. And those can be low-grade partial tears where just a little bit of the tendon is torn, up to high-grade partial tears where only a little sheet of the tissue is left that you just can't see through. Full thickness tears, however, you can see right through the tendon where it attaches to the bone because it's detached in that spot. Those can be categorized into small, medium, large, and massive, depending on how big that area is that's torn off. There are two broad categories of treatment of rotator cuff tears: non-surgical and surgical. Whenever appropriate, we proceed with non-surgical treatment. The treatments that are non-surgical don't heal the rotator cuff. It remains torn to whatever extent it's torn, but sometimes they can make the symptoms quite a bit better. The non-surgical treatments include things like medication, activity modification, which means if it hurts, don't do it. Therapy exercises can be very helpful to strengthen the tissue around the rotator cuff and take some of its job away from it so it's not as painful itself. And injections can sometimes be helpful to calm down an acute problem with the rotator cuff. For full thickness tears and higher grade partial thickness tears, many times these non-surgical treatments don't work, and we consider surgical treatment. Fortunately, surgical treatment for rotator cuff tears is outpatient and arthroscopic. The patient goes home the same day and the surgery is done through small incisions, and we visualize the inside of the shoulder using a camera and using a monitor. For smaller partial thickness rotator cuff tears, many times just cleaning up the torn portion, leaving the good part behind, and removing any tissue that's causing trouble with the rotator cuff helps the patient and solves the problem. And fortunately, in that situation, the recovery is fairly short. The sling's only for a few days, therapies maybe 4 to 6 weeks, and the shoulder just gets better week by week. Additionally, without having done a formal repair, there's not a big need to protect the shoulder so the patient can move forward with activities like they feel like. With a rotator cuff tear that's torn enough that needs repair, That's what we do at that time, still through the small incisions and using the arthroscope. The patient still goes home the same day. However, they'll use a sling for several weeks as that tendon starts to knit back to the bone. Even in the sling, the patient can use the hand for light activities. They can hold a cell phone or a drink, keyboard on a computer, and as long as they're not moving their arm away from their body and they're staying in that sling, they can be very functional with that hand. Once out of the sling, typically around 5 weeks from surgery, the patient can use their hand for daily activities. They can position it anywhere in space that they want to, but just need to limit how much weight they use to however much force they're using on that arm in physical therapy. That therapy starts within a few days after surgery and typically lasts around 12 weeks. At the end of that 12-week time frame is usually the last visit with the patient in the office. At that point, they typically feel very well, but do have some deficits. Not much strength, not much endurance. The shoulder can still be sore sometimes and maybe stiff in some planes for a little bit. At that point, the shoulder's about 50% of where it's going to be. I encourage the patients to continue their home therapy exercises for the next several months and to protect the shoulder from big, strong activities until about 6 months from surgery, at which point they can do whatever they feel like doing with the arm. If you're having a problem with your shoulder, reach out to us at the Orthopedic Center. We'll be happy to help.